So can you perform a lip enhancement if your client has a piercing? Really common. Most people who inject will happily inject for a year or so, and then suddenly you'll have a patient attend with a lip piercing and you suddenly think, I've not been in this situation before, what do I do? So let's break it down and think about what the potential risks would be. First thing is, if it's just been done, if you just had the piercing, absolutely don't treat, because you've got medical complexity there. You might get an infection or an outbreak of cold sores, and you just don't want that complexity at the point where you're doing the procedure. So like with everything, we say leave 2 weeks, wait for it to heal. When it's stable, then you can consider what to do next. So the next thing would be, what's likely to happen to that piercing or to that area if you do a lip augmentation. Main one, I think, would be swelling. And if it swells, you might be in a position where you need to remove the piercing in order not to compress the skin too much. And this should be discussed with your patient before you do the procedure. Are you happy to remove that piercing for the whole period while you have swelling with your lips? Because that's probably going to be post-procedural. It could be reactive. It doesn't really matter. The point is you're trying to protect the lip from compression if that piercing is too tight when it swells. The second element might be, what about if the augmentation is big enough to actually change how that piercing sits in the skin? So this should also be something the patient should be aware of. They should be aware that you're making their lips bigger, and that could impact the size of the piercing they could have. I see that as less of a risky issue, because mostly you're not going to be making augmentations that are that big, but it's worth saying out loud to your patient, if your lips are bigger, your piercing may not fit as well, and it's just worth saying that out loud. Finally, I think it's very unlikely, but I would just be very careful about going anywhere near the actual hole that's been injected, because you just don't want an infection to occur because of your procedure. So needle needs to stay a long way away from wherever that piercing is passing through, so that there's no complexity involved. If there was to be an infection, it wouldn't be your fault, and it's less likely to cause any problems. So just stay away from the actual hole, and that should protect you from most of the other things I would worry about.